Occupational English Test. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part C. In this part of the test, you'll hear 2 different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1. Extract 1. Questions 31 to 36. You hear an interview with Dr. Alex, a pain management specialist, discussing pain management and the use of painkillers. You now have 90 seconds to read questions 31 to 36.
Good morning, Dr. Alex. Thank you for joining us today. We're talking about pain management, a very important topic. Can you start by telling us what the biggest challenge is in managing pain?
Good morning. Yes, one of the biggest challenges is finding the right painkiller for each patient. Pain is very individual, so what works for one person might not work for another.
I see. What about over-the-counter painkillers like ibuprofen or paracetamol? Are they safe for everyone to use?
Well, they can be safe if used correctly, but it's important that people don't use them for too long. They're best for short-term pain relief. For chronic pain, other treatments might be more appropriate.
What should doctors keep in mind when prescribing stronger painkillers?
Strong painkillers, like opioids, can be effective, but they can also be addictive. It's crucial to monitor the patient closely and to use the lowest effective dose.
Besides medication, are there other ways to manage pain?
Absolutely. Regular exercise can help manage pain, especially for conditions like arthritis. Staying active is important, but it should be done carefully and ideally under the guidance of a healthcare professional.
How important is it for patients to be involved in their pain management plan?
It's very important. When patients understand their condition and the treatment options, they're more likely to follow the plan and manage their pain successfully.
Thank you, Dr. Alex. So, to sum up, the best way to manage pain is
by using multiple methods together: medication, exercise, and other therapies. A combined approach usually works best.
Now look at Extract 2. Extract 2. Questions 37 to 42. You hear a presentation by Dr. Brian, a specialist in rheumatology, discussing medications used to treat gout. You now have 90 seconds to read questions 37 to 42.
Good afternoon, everyone. Today, I'm going to talk about the treatment of gout, a common but painful condition. The main goal of gout treatment is to reduce pain and inflammation during an attack.
What is the first-line treatment for an acute gout attack?
The first-line treatment is usually colchicine, a medication that helps reduce inflammation and pain quickly. In some cases, non-steroidal anti-inflammatory drugs or NSAIDs, like ibuprofen, are also used.
What about long-term management? How do you prevent future gout attacks?
Long-term management typically involves medications that lower uric acid levels in the blood. Uric acid is what causes the crystals that lead to gout attacks. In addition to medication, lifestyle changes, such as avoiding foods high in purines, can be very effective.
Can you elaborate on the lifestyle changes?
Certainly. Patients are advised to drink plenty of water, maintain a healthy weight, and avoid foods like red meat and seafood that are high in purines. These changes can help prevent future attacks.
Are there any side effects of the medications used for gout?
Yes, some patients might experience stomach upset, particularly with medications like NSAIDs. It's important to discuss these potential side effects with your doctor.
Finally, what's the most important thing for patients with gout to remember?
Regular blood tests to monitor uric acid levels are crucial. Staying on top of this can help prevent future attacks and manage the condition effectively.
Thank you, Dr. Brian.
You're welcome. Thank you all for your attention.
That is the end of Part C.
AVN Pharma Education.